the new scientific methodology for cupping therapy.
So, let's talk about the scientific methodology of hijama. Now, when you hear cupping, you probably think of something ancient, right? A tradition passed down through the ages. But what if I told you it's also becoming a modern science? That's what we're digging into today. A structured approach that's all about evidence, individualized treatment, and results you can actually measure.
So is hijama, or cupping, just a traditional practice? I mean, for a lot of us, that's exactly what it feels like. It's this remedy that's been around forever. But is that really the whole story? Could there be a truly rigorous scientific process kind of hiding in plain sight? Well, it turns out the answer is a big, resounding yes. A new scientific methodology is out there, and it's completely transforming this ancient therapy. And it's really being pushed forward by researchers like Dr.Ali Gaml, who are working to turn this art form into a modern, evidence-based science. Okay, so what does it even mean to apply a scientific methodology here? Well, it's all about making a major shift. Moving from a focus on tradition alone to tracking hard data and getting measurable, repeatable results. So here's the core idea. We're moving way beyond just doing cupping. This is all about applying it based on solid, documented scientific evidence. And why? To get results that you can actually measure and, this is crucial, repeat time and time again. Let's make this super practical. Imagine a case study. Someone comes in with migraines. Instead of a one-size-fits-all approach, the first step is to document everything: the type of headache, how bad it is, how often it happens. Then a very specific treatment is applied. And here's the key part. You measure the improvement after each session using a standardized pain scale. It creates this data-driven feedback loop. Now, this entire methodology is built on 4 core principles. You can really think of them as the practical pillars holding the whole thing up, making it both effective and safe. So let's break them down. Pillar number 1 is all about evidence-based assessment. This isn't guesswork. Treatment starts with a real, hands-on clinical exam to identify the pain and muscle tension. If needed, you bring in the modern tools like X-rays or MRIs. And it also means digging into the existing scientific studies to pick the best possible treatment path. It's about making decisions based on data, not just tradition. Next up, pillar 2, individualized treatment. And this is so important because, let's be real, no 2 patients are the same. A practitioner assesses a patient's unique history and sets clear goals, like our target is pain relief. That goal then dictates everything: the type of cupping to use and the precise anatomical points to target. And this is a perfect illustration of that. For, say, a simple muscle spasm in the neck, our practitioner might use dry cupping, just applying section. But for something like chronic migraines linked to the venous sinuses, they might choose wet cupping, which involves tiny incisions to draw out a little blood. See? Different conditions need completely different tools and techniques. The third pillar is all about monitoring and documentation. This isn't just about taking a few notes. It's about systematically tracking symptoms before and after every single session using those standardized scales. You might even track vitals or lab results. All this data creates a trail that lets the practitioner adjust and optimize the treatment plan in real time. And the final, and you could argue most important pillar, safety first. This is completely non-negotiable. It means using sterile, single-use tools to prevent infection. It means screening every patient for potential risks, like bleeding disorders. And of course, it means monitoring for any side effects and making sure the practitioner is trained for emergencies. Because without safety, none of the other principles matter. Okay, so we've covered the 4 pillars of the methodology. That's the what. But now for the really big question. How does it actually work? Let's dive into the biological mechanisms that might explain what's going on. The entire approach is built on a deep understanding of human anatomy. Knowing the precise locations of nerve pathways, muscles, and blood vessels is what allows a practitioner to target the treatment for maximum effect. You could say it's the map that guides the entire process. And this table here really shows how practitioners can leverage the body's own wiring. By targeting specific points along the spine, they aim to influence the central nervous system. For example, stimulating the upper spine can affect the signals related to neck tension and headaches, while targeting the lower spine can help with back and leg pain. It's a precise system of inputs and outputs. So how does it actually tackle pain? Well, the science suggests a kind of three-pronged attack. First, it can trigger the release of your body's own natural painkillers, like endorphins. Second, it improves blood flow to the area, helping to wash away inflammatory stuff. And third, it helps rebalance the nervous system to calm down those painful muscle spasms.
And it's not just about pain. The research also explores these really interesting effects on the immune system. The therapy is thought to stimulate the production of white blood cells, reduce pro-inflammatory substances, and increase anti-inflammatory proteins. In short, it aims to help modulate the immune response and encourage the body's own natural repair mechanisms. So let's bring all this together. What we're really seeing here is a huge effort to bridge that gap between ancient wisdom and modern scientific principles. And this quote just says it all perfectly. Adhering to these principles makes hijama a science-based therapy, not just a traditional practice. That's the key takeaway. And the end goal here is pretty clear. By putting this systematic, data-driven methodology into practice, the aim is to make hijama therapy safer, more reliable, and ultimately more credible in the eyes of both patients and the broader medical community. And this leaves us with a fascinating final question to chew on. If other traditional therapies adopted this kind of rigorous, systematic framework, could that be the key to finally integrating them fully into modern healthcare? It's definitely something to think about.
The new scientific methodology for cupping therapy.